TV9 News. I'm your host Ashish Parekh. As the country is struggling from the second wave of the Covid-19 pandemic, one of the striking features of this particular wave is the fact that younger age groups are also getting severely infected, and also the other thing that we're noticing is that a lot of pregnant women are also getting infected because of a drop in their immunity levels. So this raises a very serious questions. How will a pregnant mother who is COVID positive actually affect her newborn baby? What are the risks of a newborn being exposed to a COVID positive mother? Should the newborn be separated from its mother if she is COVID positive? What are the risks involved if the mother and the child are kept together? And how do you keep the baby safe in such conditions and cases? These have been some of the most frequently asked questions during the pandemic, and seeking answers to these, researchers at the Karolinska Institute and also the Public Health Agency of Sweden carried out a survey between March last year, March 2020 to January 2021, and this particular study tracked over 90,000 childbirths in this particular period. And they also tried to find out the reasons and the risks which are involved and try and demystify some of the things that are being said about this particular scenario. Well, so what did the study find? Among those involved in this particular study, 2,323 babies were born to mothers who had tested positive for COVID-19, and out of these, only 21 babies, that is only 0.9% of the babies, tested positive after birth within the first 28 days, which is the newborn period. And also, a majority of these babies who tested positive did not have any symptoms. So how do we derive the study? What are the findings and how exactly do we understand it? To speak to us more about this, we are joined in by Dr. Smriti Nayak, who's a consultant and gynecologist at Aster ARV Hospital. My first question, doctor, to you is, how severely does COVID-19 infect pregnant women, and is it advised to keep the newborn baby separated from its COVID-19 positive mother?
With the increasing number of COVID cases in the second wave, we are seeing a lot of pregnant women also being affected by it. Considering the reduced immunity in pregnant women, the disease affects pregnant women very severely. So, big question which arises here is, what do we do with the baby after the delivery? Some of the studies show that isolation or separation of the baby from the mother is really not required, and we also recommend the same. The mother has to use all the precautions like double mask, gloves, face shield, as well as constantly sanitizing all the surfaces that are being utilized while the breastfeeding is happening. Babies require breast milk. They need this for their nutrition as well as improving their immunity. So we do not recommend isolation of the baby after the delivery. The babies also have certain special care and needs such as bathing as well as changing of diapers, which is usually being done by the family members. So we highly recommend that all the family members also take very stringent precautions, which includes the gloves, the mask as well as face shield while taking care of the baby.
Also, the second question is, what if the mother is highly infectious and cannot actually tend to the baby? What should be done in such scenarios?
With certain mothers, the infectious period, which is of around 14 days, they would have already crossed it. So actually the transmission will be very low. But in certain scenarios where the mother is highly infectious and having lot of symptoms, the precautions that I've already mentioned needs to be maintained and followed very strictly. In certain other cases where the mothers are severely affected, which may be present in the mothers being in the ICU, or if they require a lot of oxygen support, then the babies can be given some formula feed under the guidance of a pediatrician. To sum it all up, with this second wave, pregnant women need to be extremely cautious and avoid going to any social gatherings or have ceremonies at home, and maintain all the stringent protocols that we have been advised to take.
Well, that was Dr. Smriti clearly advising and also telling us about the protocols that need to be followed in such cases. Now, this particular study has been published in the JAMA journal, and also it is one of the biggest studies that has been carried out in this particular domain. And also the advice by Dr. Smriti could also help you and help you understand the situation better. And in case anyone that you know is also going through a similar scenario or a situation, you could be in a better position to advise them. Do let us know what you guys think in the comment section below, and also do not forget to like, share and subscribe to TV9 News. Thanks a lot for watching.